Hi, Mike Gibson, Tiffany Patterson coming to you from ESC 2023. We're talking about the arrest trial, which looked at expedited transfer for cardiac arrest. Tiffany, talk to us a little bit about what you did and what you found.
So, what we realized was that the idea of cardiac arrest centers were expanding. So, out of hospital cardiac arrest is a major public health burden. And what we really want to know is if following resuscitated cardiac arrest, if patients fare better taken to a specialist center compared to taken to their local emergency department. So we designed this trial in 2012 and it commenced in 2016. And what we did was we randomized patients one to either following a cardiac arrest, to either delivery to a cardiac arrest center or to their local emergency department. So these were adults over 18 with a cardiac arrest with return of spontaneous circulation, but importantly, without ST elevation on their ECG. So we were looking at the non-ST elevation cohort. So we randomized 862 patients, 431 in each cohort. And actually, we found for the primary endpoint of 30-day mortality, no difference between the two cohorts, which was very interesting for us, given that these centers, these specialist cardiac arrest centers, had the full armamentarium of kit, to provide immediate angiography, temperature control, any sort of hemodynamic support required, and ECMO-based therapies as well. But despite that, there was no difference in mortality. And that was our primary endpoint in the intention to treat cohort.
And Tiffany, what was the kind of delay between going to a cardiac arrest center versus just going to the nearest center?
So we had, I think it was a median delay of approximately 7 minutes between the two.
Wow, so
And we
not
can't
much,
say for sure. Sorry.
not much difference.
No, there wasn't. But the geographical layout of London is such that actually there's always a nearby tertiary centre. So it may be different in different healthcare settings potentially, but delaying even more by taking to a specialist centre that's further away in a different geographical setting may also impact outcomes as well.
So, what's the take-home message? What should clinicians be doing and health systems be doing, Tiffany?
Well, we conducted this in quite a dense population, and there's quite an advanced healthcare system in the United Kingdom. And based on our findings, we showed that in the absence of ST elevation, taking a patient to the local emergency department is as good as taking someone to a tertiary centre with complex cardiac intervention. So actually, there's no need to take the patient further to another centre.
Great. Well, Tiffany, thanks for sharing with us, and thanks to all of you for joining us here from ESC 2023.